Hi, this is Dr. Nick. I'm the Incrementalist, and I'm here with Dr. Elisabeth Rosenthal. It's a real privilege for me to be here. You've been an inspiration with your book, your series. You're now working with Kaiser Health News. You just presented. I think we're in a terrible state of affairs. Give me the highlight of what an individual patient should think about when they're thinking about how they deal with the healthcare system today.
Well, of course, what they should be thinking about is their health, and what they are thinking about is, oh my gosh, is this going to bankrupt me, or how could it cost that much? And I think, to me, the essence of what I do and what our mission should be is to put healthcare on the front burner and all those profit and cost issues on the back end burner. And I'm not saying, that this isn't a business. It has to be in this country, at least for the moment. But I'm saying that the business values, return on investment, should not be the decider in whether I get health care or not.
So I'll tell you, I personally have a standing order, never call an ambulance.
Yeah.
For me, as a result of the current circumstance, you even described that.
Yep.
How do people deal with that? I mean, it just seems like this has been going on forever.
Well, they get stuck. They get blindsided. I have a similar thing. When I fell in New York, I had a big cut on my head, and all these college students came around and said, "We should call an ambulance." And I jumped up. I'm like, "No, I will crawl to the hospital before." But most people don't know, right? So I think a lot of it is for a start, and it's not the end, is consumer awareness, to know that you can say no to things.
Right.
And to understand that when someone says, hey, here's an upgrade for your cataract surgery, I'm going to use a laser, to say, how much is that going to cost? And to say, is that really any better than having I think we need and it's terrible to have patients have their antenna up all the time, but you got it in this healthcare system because it's about the money, it's not about the care. And that doesn't mean there aren't a lot of really good physicians, nurses practicing in the system, but the ones who are not following their Hippocratic oath are the ones are there to take advantage of you. And I think that's why people have lost trust in healthcare, and I think that's a huge problem.
And we have to return the trust. I will say, and I'm going to hold it up, this is actually from your book. These are the guiding principles that you printed out.
They're sad, aren't they?
It is sad, but actually as an incremental approach for people, and the reason I have this is not because I knew you were coming. It sits in my wallet.
Oh, wow.
As a standing order, I created it. I put it in my wallet so that I've always got it with me. So one of the things, read the book, find this, I'll make sure I put it online. Thank you for creating that.
I should get that from my wallet, too, instead of just feeling like an angry patient all the time. Okay, well, I hope it helps, because we have to be much wiser to the games that are being played.
We definitely do. So it remains for me to thank you and suggest that people follow the Kaiser Health News. I think it's a great series. I've been following that. And indeed, read the book, Paying Till It Hurts. Great name as well.
Oh, Paying Till It Hurts was the series. The book is An American Sickness.
I'm sorry, those two.
I have too many. It's my obsession for the last 5 years. So.
Absolutely. So thank you very much, Dr. Elisabeth Rosenthal. Thank you for joining me today. It's been a great pleasure.
Thank you. Take care.
I'm Dr. Nick. I'm the Incrementalist, and I'm here with HCI with West Health.